Thank you very much for inviting me to speak. I can really, as a pediatrician who cares for both children and their families, really understand the anxiety that people are feeling. This is a really anxious time for everybody, but even more so for your children, because children are often people's most prized belongings, and they really don't want to put their kids at risk. And so as a group of pediatricians from the South African Paediatric Association and our executive, we've looked very carefully at all the current available evidence that we have. And we feel that from a COVID point of view, when it comes to children, there's a little glimmer of good news in that children seem to be affected less and they transmit less than what adults do. And so looking at all the available evidence at the moment, we feel that there are huge advantages in getting kids back to school. As Minister Schaefer suggested, this virus could be with us for a very long time. And so we want to get our kids educated. We want to get them back to school. We've suggested that we agree at the moment in that a staggered approach, getting year 7 and year 12 back to school carefully and seeing how that goes. But we know from a child's point of view, not only is their education important, and as we've mentioned, not everybody has access to online education. Many children require face-to-face education, but also from their mental and psychological well-being. So many of the children are feeling depressed because they haven't been seeing their friends and colleagues. We also know that food security is a huge matter. And I was reading a paper from the Journal of American Medical Association saying that in the USA, up to 20 million children rely on food meals for their nutrition. And I know in South Africa, that's probably even more of an issue. We also know that children who are left at home, often if their parents are now returning back to work, have big safety issues. And so for at least those reasons, we feel that children should be going back to school. When you ask about your child may have a comorbidity, we're saying please contact your health provider, your clinic, your pediatrician, your GP if your child has a comorbidity. But we found that many children with comorbidities, asthma, on immunosuppression, allergies, on the whole are actually going to be okay. And so when we've looked, children carry what we call a very much lower viral load. So that means there's not as much virus in their body. And so they tend to acquire it far less easily than what adults do. And so people feel anxious about sending their kids to school. But in many cases, parents are not that anxious about taking their children shopping with them or taking them into the community where the risk of getting this virus is as much as if they were going to school. We also know that they transmit less. So not only do they transmit less from child to child, but we know that they also transmit less to adults. And this is obviously something that makes teachers feel anxious. Are they going to get this virus from the children that they're teaching? And we know on the whole this is not the case. Adults are much more receptive or prone to getting this virus from their community, so from their colleagues, but also just from the people who live in their community, where they shop, the taxis they travel in. So we feel that for children, it is a safe environment, provided you stick to the basics. So the basic rules include, 1, wearing masks, and we are not saying just visors. We're actually saying you need a mask at the very least. 2, keeping your hands clean, either with alcohol sanitizer or with soap and water. And 3, social distancing. And recently the WHO has come up with a very nice article that you can look up that suggests some different ways of thinking about it. So don't have all your school breaks at the same time, maybe stagger your breaks. Think differently. If children are nervous about going back to school, I've seen a couple of the schools in the Western Cape have actually come up with little videos that they share on WhatsApp. I watched one last night where the teachers were acting as students going back to school, showing them how to have their temperature done, how to clean their hands, and how to sit socially distanced away from their fellow students. So those are the basic rules. And then the golden rule is if you are feeling sick, either as a teacher or as a pupil, you should not be going back to school, but should rather have medical attention and have yourself tested. So those are the golden rules. We spoke about closing the schools, and the WHO also suggests that maybe you can think about closing individual classrooms rather than closing a whole school, because it's the people within the classroom that may be transmitting it. So if you've got one student or one teacher, instead of closing the whole school, you may want to consider closing specific classrooms rather than closing the whole school. And I agree that there's no real reason for advertising which school has got it, because at the end of the day, I think most schools will have either a student or a teacher, because it just reflects what's actually going on in the community. And in the Western Cape, we've got a lot of COVID infections, and it's not specifically related to the schools because they've been closed for the last 2 or 3 months. And then I just want to just show a couple of slides quickly, just related to any potential children that might have died. And this is before the schools opened. So next slide, please. So these are the stats in South Africa from the 9th of June. The next slide. In the Western Cape, we can see that in the age group between 0 to 20, as of the 9th of June, there have only been 5 deaths. In fact, I think it's just been updated to 6 deaths, but there are 0.2% of the total number of deaths have been in pediatrics. And I'm going to show you that that is a worldwide phenomenon. Next slide, please. So I'm going to ask my assistant to point right at the top on the left is a little dot that's the size of a pinhead. And that is the number of cases in the UK under 15 that have actually died of COVID-19. If you look at the other circles, obviously the people over the age of 75 is the very large circle, and the other age groups 15 to 44 is the next biggest circle. But you can see that very, very tiny little pinhole right at the top. That's the number of cases of children that have actually died of COVID. So I think children on the whole are going to get off this a lot more likely than the adults would. This is usually different in other infections, but in this situation, there is a little glimmer of hope in that COVID seems to affect children far less than adults. Next slide, please. So just to show you the cases that we've tested at the Red Cross War Memorial Children's Hospital, we've only had 3% positive children. The rest have all been negative. Next slide. And if you break these down, the number of children under the age of 5 are the ones that we've tested on the whole more than the older children. And you can see a much smaller number of children are positive than those that are negative. Next slide. So just to talk about those deaths, because as soon as you hear that there's been a death in a child, there's an appropriate emotional outcry, because people say, well, there are deaths in children, but the important cases and the 2 that we've had that I've been involved in at the Red Cross Children's Hospital, one of them was a very young child with a severe cardiac defect, and the other child had a severe lung defect. So these children had severe underlying comorbidities, and they also happened to then be tested to be COVID positive. So I think it's important, as in the adults, to actually look at what else is going on in this patient's life. Next slide, please. So how are we managing this in a hospital? And you can take a similar situation in a school. Next slide. So masks, and I think this is a very emotive issue, is that of children's masks. A lot of people say, well, children can't wear masks, but it depends how you educate them and how you work with them. Children are great mimickers. They love doing what adults do. And here you can see a mom and a child both wearing a very light, bright colored mask, and children learn very quickly. So we found in the hospital, we are getting parents and their children to wear masks, and you can do the same in a school. You can make it a fun event, and any concerns about masks blocking oxygen or retaining CO2 is simply not founded. We find children get used to masks possibly even more quickly than the adults do. So masks are good for us. Teaching children to clean their hands. So if everybody does it, children are copycats. They'll learn very quickly to keep their hands clean. And then obviously social distancing can be a little bit more difficult with kids, but if you make it a game at school, then children learn quite quickly. Next slide. So just to show you the cases that we've had at our hospital, on the right-hand side, 55 patients and currently only 9 children with this condition. Most of the children have recovered really quickly and have gone on to go home back to their families again. Next slide. Just the important thing for adults who are working with children, be that nursing staff, medical staff, school teachers, school administrators, important to get physical distancing. And we've gone a three-pronged approach. We've said watch out for those tea rooms, watch out for those play areas, possibly remove chairs in that area. Next slide, please. And so we've actually, you can see in the middle, there's a slide of a tea room where we've actually taken chairs away so people can't sit too close to each other. And then the 2 slides below, you can see there's some red stripes. This is where people who are needing to stand in a queue are social distanced by the red stripes. And you can do the same at school. So I've seen some very nice schools in the Western Cape actually put some either squares or lines or even crosses on the ground to remind people to social distance. Next slide, please. So in closing, I'd like to say that I think we feel quite comfortable that children should be getting back to school. It's the best place for them to be. If this virus is going to be with us for the next year or 2, we can't realistically teach all these kids online. We need to do so safely, and I think hand cleaning, face mask, social distancing, really important. Really important if you're feeling sick as a teacher, don't be a hero and go to school. We normally would do this, but in this virus, we're saying stay at home and get help. And if you're a child who is ill, the same would hold for you. Don't go to school. And I think as a community, we need to be supporting each other. We need to realize that there's a lot of anxiety around this. But as a pediatrician, we're saying on the whole, children are actually going to be okay. And if you are worried about your own individual child with some comorbid conditions, please ask your healthcare workers so that we can reassure you and give you the appropriate advice. Thank you very much.